Hey guys, I am going to perform the cervical examination. This is my patient Angelina, and this is the second part. After you take the history, you go into the first exam, which is the cervical exam. All right, so I'm going to try not to commentate as much and just run through the entire exam. I'll make little comments below on what I'm doing specifically, and then if you guys have questions after you've watched the video, let me know. Hi, my name is Josephina.
Hi.
I will be your intern today, and we're just going to run a cervical examination on you, okay?
Okay.
Okay, great. So we're going to start with shoulder abduction. So go ahead and you're going to bring your arm 90 degrees out to the side, just one at a time, okay? And I'm going to hold this for 5 seconds. I'm going to push down. Just meet my resistance. Don't let me push your arm down, okay?
Okay.
All right. Good. And then you're always doing this bilaterally. Good. And go ahead and do a bicep curl. Okay, and same thing, don't let me push your arm out. Good. Engage. Good, keep this arm up. You're gonna push against me, okay?
Okay.
Good, any pain with those?
Nope.
No? All right, so now we're going to do wrist extension. So you're just going to bring your wrist up here. Okay, we're going to do one at a time, okay? Don't let me push you down. Good. Good, and wrist flexion. Go ahead and turn them in this way. Perfect. Don't let me pull this out, okay?
Okay.
Any pain?
Nope.
Any pain?
Mm-hmm.
Okay. So now finger flexion. So your fingers are going to be curled like this. Okay, don't let me pull your fingers out, okay?
Okay.
Any pain?
Uh-huh.
Okay, and then fingers up. So facing up. Perfect. And push down. Any pain?
Mm-hmm.
Okay. Go ahead and bring your fingers here. Great. I'm going to intertwine mine. Go ahead and squeeze them.
Okay.
Any pain?
Uh-uh.
Okay. And now leave them out. I'm going to squish each one of your fingers together, okay?
Okay.
Any pain?
Nope.
Any pain?
Nope.
Any pain?
Nope.
Great. All right, so now I'm going to do a couple orthos on you. I'm just going to stand behind you, and we're going to do a couple with your head. So I'm going to push down, lift up, and do different angles, okay?
Perfect.
All right, so just look straight ahead. I'm going to push down on your head, all right?
Okay.
Any pain?
Nope.
Okay. To the side. Any pain?
Nope.
Okay. Other side. Any pain?
Uh-uh.
You're going to look down, chin down. Any pain?
Mm-mm.
And looking up. Look up.
Oh, sorry. It's okay.
Any pain?
Nope.
Okay. And now I'm going to lift your head up and let me know if this relieves any pain or any tingling that you feel, okay?
Okay.
Any tingling?
Nope.
Relief of pain? Okay. All right, and now I'm going to flex your head over and then bring your shoulder down, okay? So just look forward.
Okay.
Any pain?
Nope.
Okay. Any pain?
Nope.
Okay. And now we're going to do VALSALVAS. So this one's going to seem a little bit weird. I'm going to sit down and do it next to you. So what you're going to do is you're going to take a deep breath in when I tell you to. You're going to hold it in, and then you're going to bear down. Okay, so kind of like you're going to the bathroom.
Okay.
All right, next one is I'm going to have you, we're going to do one hand at a time. So you're going to just do this. Okay, and hold a fist. And bring it down. And go ahead and open up your hand. Great. Other side. Squeeze, squeeze, squeeze. Close your fist. Open your hand. Great. Other side. Squeeze. Good. I'm going to bring it down. Open your hand. Good. One more time. Close your fist. And open your hand. Great. All right, so next one I'm going to do absence. So just look straight ahead. I'm going to check your pulse. And go ahead and look towards me. And look away. And I'm going to do the other side.
Okay.
So look straight first, and then now look at me. And look that way. Great. All right, and Eden's. So go ahead and bring your arms behind you. So I'm gonna just check this. And you're gonna bring your head down to your chin and hold your breath. Good, relax. And hyperabduction. So I'm gonna take one, just go ahead and look forward. And bring it up. So with all these, you're checking for pulse amplitude. And then if there's any difference on either side, it usually indicates thoracic outlet syndrome. All right, so now I'm gonna have you do ROO'S. So this one, your arms are gonna be 90 degrees, and you're just gonna flap, okay? Let me know if there's any pain, tingling, or loss of sensation at any time. Okay. While your patient is doing ROO'S, you're gonna have them read the questionnaire. Okay. So I will just have them, when you have your clipboard with the paper on it, just have them read the question and let them know what letter to choose. So number 1.
A.
Great. 2.
A.
3.
C.
4.
A.
5.
A.
6.
A.
7.
F.
8.
A.
9.
A.
And 10.
A.
Okay. And remember, your patient is doing ROO'S test for 3 minutes. So after they have gone through the index, the questionnaire, you will score it. Remember, it's out of 50. And I will go through the numbering for each letter during tutoring. You will get this signed off by a clinician to make sure your scoring is correct. When you come back, that's probably a good time that you can have them kind of stop and just ask for any pain or tingling. All right, go ahead and relax. Any pain or tingling?
No.
No? Okay. So now we're going to do light touch. I like to use a Q-tip, so carry these in your bag. And you just kind of whisk out the end of it so that you have a nice little cotton flippy thing. All right, so first I'm going to have you expose your sternum. Okay, so you know what it feels like. Okay, I'm going to be doing that to the palm side of your hand, okay? So I'll have you close your eyes and arms out. Okay, just let me know what finger that you feel it on, okay?
Okay.
Go ahead and spread your fingers out for me. There you go. Great. All right, pinwheel. So I don't have my pinwheel. I don't have all my supplies since we're in this quarantine, but I'm going to pretend this is my pinwheel, okay? And your patient will typically have a gown, so it'll be a little bit easier to kind of expose the arm, but you guys will get the idea, okay? So go ahead and expose your sternum again. And this is what the pinwheel is going to feel like. I'm going to have you close your eyes, and your arms are going to be here, okay? So close your eyes. Okay. So does this feel the same as this?
Yes.
Great. And does this feel the same as this?
Yes.
Okay. How about this to this?
Yes.
And then this to this?
Yes.
Okay. And does this feel the same as this?
Yes.
Great. And you have T2, which is up here, which typically they will take their gown and kind of expose this area for T2. So T2 is right here. Does that feel the same as that?
Yes.
Okay. And then we're going to do vibration. So go ahead and relax. Okay. So for this one, you're going to use one of your tuning forks, okay, where you hit it and it's going to be vibrating. I have a hammer for me. So same thing. You're going to close your eyes and you're going to just feel. I'm going to do the vibration. It's going to start, and then I'm going to stop it. So when I do it on your fingers, you're going to let me know when you feel it start and stop.
Okay.
So this time your hands are this way. Perfect. Close your eyes. Just start.
Start.
And stop.
Stop. Start.
Great.
Start. Stop. Start. Stop.
Great. All right, and then we're going to do reflexes. Once again, my nice reflex hammer. So we're going to do the biceps. So, go ahead and turn that way for me. You can turn your head. Great, go ahead and relax your arm. Great. Okay, this one. Relax the arm. Good, I think I got some, huh? And then this one. Good. If you have a hard time finding the brachioradialis, you're going to have the patient bring up their hand. So flex. Just do this. Look at me. Go up. So side.
Oh,
Straight up. Okay, and then resist me. So push down. Good. And you can feel the brachioradialis. Okay, and then you'll put your thumb over that. Relax, and look that way. Great. Okay. And tricep. So I'm going to come behind you. Okay, and relax your arm. Great. Good. Same thing. Make sure to not stand directly behind your patient because their arm will flail and could hit you. So off to the side and there. Great. And BABINSKI'S. So I'm going to go ahead and have you put your feet up here. You can do one foot actually. So this is BABINSKI'S. You would have the patient take their sock off. You don't have to if you don't want to. Okay, and you're just gonna make the J. So you're gonna come around and off the big toe. Okay, and you are looking for the toes to curl in. If they go up, toes curl up. That could be a indication of an upper motor neuron lesion. Remember, that is only normal in babies to flare their toes out. And the last one is the grip strength test, which I do not have the JMAR tool, but we can go over that in tutoring. If you ever don't have it, sometimes in clinic I don't have the actual tool. So what you will do, go ahead and face forward, is you would have them squeeze your fingers, and you're just gonna kind of get a feel of if there is any weakness in their grip strength, okay? So go ahead and you're gonna squeeze my fingers. Okay, squeeze as hard as you can. Hard, hard, hard. All right, relax. So if I feel a weakness in either one, that could be a lesion of the C8 or some kind of issue with that nerve. Okay. All right, so that is how you would do your cervical examination. I will make another video to show the extremities, so the next one will be a shoulder. Okay, if you have any questions, we will go over them on Wednesday. Thank you.